You are in the trauma ICU and you are monitoring the patients. Most of the patients in the ICU are unconscious. So, obviously, they cannot take any oral feeds. You are maintaining them on IV fluids itself. You saw one of the order of the patient, which is saying that the patient should get 4 pins of D5 and 2 pins of RL for the whole of the 24 hours. So, you started to wonder, are we giving sufficient calories to the patient just by IV fluids? So, you started to calculate. An average person will require 30 kilocalories per kg body weight. The weight of the patient is 50 kgs. So 50 into 30, he'll be needing 1500 kilocalories per day. And if you see D5 or DNS or D25, one pint of each of them will contain 25 grams of glucose. And you know, 1 gram of glucose will give 4 kilocalories. So each pint of this D5 or DNS or D25, they will give 100 kilocalories. And you are giving 4 pints of D5 to this patient. So he'll be getting 100 into 4, 400 kilocalories. But the actual requirement is 1500 kilocalories. So he's having a deficit of 1100 kilocalories. What can you do about that? He cannot take any oral feeds, true, but you can still place a RT for this patient, that is trials tube, and you can give RT feeds for this patient. And by that, he will get the adequate calories which are necessary for the body to metabolize and give him sufficient energy. But what if RT feeding is contraindicated for this patient? Like for example, the patient with acute necrotizing pancreatitis or a patient having high output intracutaneous fistula, what about them? You can give total parenteral nutrition for that patient, and by that he will get adequate calories. So now you know. Let's meet in another video. Until then.